Hi everybody, it's week 3 after my spinal fusion on my L4, L5 vertebrae area. And I accidentally skipped week 2, but I did have my post-op appointment during that week. And talking with my doctor and his physician assistant who assisted me in the surgery and has been very closely monitoring me this entire time. Things look great. I actually had an x-ray of my posterior, spine, and then my left side, from the left angle, just because that's the side that I was having the majority of my issues on. And everything as of right now looks perfectly fine, she said, and everything seems to be on track. I still have to wear my back brace for 6 to 8 weeks. Other than that, she gave me the approval to not have to have my walker with me 24/7, thank God. I have been walking around the house pretty much just with my back brace, and the walker is currently folded up in our bedroom right now. I do take it when we leave places just because I know the surfaces of my own home, but when it comes to leaving, it's nice to have it with you because you don't want to trip and you don't want to jolt yourself and you don't want to accidentally fall and have nothing to grab onto. So I do keep it pretty close with me when I go, and hopefully, I can switch over to a cane and stuff like that. But pretty much week 2 went pretty smooth with everything when it came to my appointment. One downfall and complication I did have, which it was very minor, is it could have turned into something bigger, but I talked to them immediately as soon as I noticed something was going on. Everything looked fine on my incision, and I did not have staples and I did not have external stitches. I had internal dissolvable stitches with terry cloth strips. So once all the terry cloth strips came off, the dissolvable stitches, one layer of them had prematurely dissolved, causing some leakage coming out of my lower back. And typically you change your gauze about every 24 hours. At least that's what we were told from the hospital and from my doctor. And my husband had to change it 2 to 3 times a day for me because it was kind of like a yellow leakage. It never turned into like a green pussy leakage or anything like that. It was just very thin and yellow, but it was a lot. And changing 2 to 3 times a day, and it was going through 2 layers of gauze, not just one, it didn't seem normal to me. So I brought it up to her, and she said, she was very thankful that I brought it up to her because you don't want an infection in your spine. I mean, that's the last thing anybody wants. So I was put on an antibiotic regimen for 10 days and to take 4 pills a day. And we are 1 week out after being prescribed that, and I have no leakage anymore coming out of my back. It has completely cleared the issue, but you still want to continue to take your medicine all the way till the end, You don't want anything happening. It's been pretty smooth. Everything has been pretty easy. I went out to dinner for the first time 2 days ago, and it felt great. For a while there, I was sore, and I also didn't want to take my walker because it's kind of hectic trying to get that, places. You don't want people tripping over it. You want to make sure you're okay. And especially being in a back brace, it is not comfortable to be out in public in a back brace because, I don't care about people staring. That's the last thing I care about. It's just the comfort of it. It's just very uncomfortable. And at your own home, you can throw on some pajamas and be comfortable in it. And having to wear it for 6 to 8 weeks, life doesn't stop. So you have to continue on. And we're in week 3 right now. This is the first week that I actually... my husband went My husband went back to work 2 days ago, and I was glad to have him home for the first 2.5 weeks because he cooked, he cleaned, he did the laundry, he helped change my gauze. Whenever I use the bathroom, I mean, you need help for a little while wiping, and stuff like that. And not only that, you don't want to slip in the shower, and we don't have one of the showers that's like a separate shower. We have one of the step-in, we have a tub shower. So he did get a shower chair, which that helped so much. And I was able this week to stand up for not stand up because I've been standing up, but for my first time in the shower by myself, being able to stand up and have no assistance, not using the shower chair or anything like that. And I was able to do it all by myself. The shower chair still definitely makes it easier for women when they need to sit down and shave their legs because you're not able to bend or twist or anything like that. But other than that, I feel pretty much independent. I'm able to cook. You still can't. I'm on the restriction of not being able to pick up more than a gallon of milk, and she said that will be for still the 6 to 8 weeks. So I'm in week 3. I'm kind of counting down the days, because I want to be done with this back brace and everything. But you don't realize until it's taken off how much of a relief it actually it helps when it's on. Walking around, it gives you that stability, and it actually structures your posture so you stand up a lot straighter than you think you normally do. And as of right now, I'm just getting used to kind of the stiffness. I definitely feel that I have metal in my back. I can't feel the metal in my back completely, but I can feel the area that the surgery was done on, and it feels stiff in that area. But it was also the lower part of my spine where most people twist and move. Other than that, I'm still not bending, still not twisting. I noticed I have had my husband take a picture, since obviously, you can look in the mirror and everything like that, but, showing my parents, since I'm married and they want to keep updates and everything. We've taken a picture every day of my incision, how it has changed progressively over the time, and the top of it has closed almost completely. It had the scabs completely gone and everything. The lower part, because that's where I had the leakage, is taking a little bit longer to close. So as of right now, it feels great. There is bruising. The bruising has set in, because beforehand it was just, everything looked great, and I was kind of shocked that there was no bruising. But right now, I've gone through every shade of bruise. I'm in the purple phase right now, and it looks like someone beat me up, like my back. And, and it doesn't help that you constantly have the tape around your back, with the gauze, just until it's completely closed. You get sore, and having a back brace on it and everything, it just, it gets to a point where you get sick of it and you just need a break for a little bit. So sometimes I'll take a little bit of a nap with, not having any gauze or anything on it. But other than that, like I said, walking's been great. My legs both feel completely normal, which thank God, because I was not able to walk for weeks, before I had the surgery. So I'm definitely thankful. And I'll remember, I promise, next week, week 4, I'll keep you up to date on everything. But as of right now, that's what's happened the last 2 weeks. So I hope everybody who is watching this or has looked at this, has encouragement and knows that it does get easier. So have a great week, everybody.